My name is Steve Holland. I'm a clinical psychologist on faculty at Vanderbilt University, and I'm running for APA president. There's no non-psychotic disorder that's not treated at least as well with psychotherapy as with medications. I'll illustrate with depression, but this generalization holds for most of the non-psychotic disorders, and they account for about 85% of all the people that seek any kind of psychological treatment. Not only do we do as well over the short run, we tend to have long-term enduring effects that medications simply can't last. That's not true only for the cognitive behavioral interventions, also true for dynamic psychotherapy, and probably true for humanistic approaches as well. Medications, as useful as they can be for some people, typically only separate from pill placebo, that is, have a true drug effect among patients with more severe depression, the people to the right-hand side of this kind of graph. Nonetheless, we've lost market share to medications over the last 25 years since the advent of the selective serotonin reuptake inhibitors, the SSRIs. And that's mostly because general practitioners are comfortable prescribing them. They don't know what else to do. You can see how costs for medications have exploded over the last quarter century. Costs for reimbursements for psychotherapists stayed relatively constant. That's not the way it is in England, where they have the NICE guidelines, multidisciplinary guidelines commissioned by the National Health Service that evaluate the different kinds of clinical interventions. There, they've invested £700 million to train psychotherapists to provide the psychological interventions because they are simply more cost effective. The recovery rates have boomed as well. They've gone from the mid-30s up over the 50% line. It's an intervention process that really clearly works. We could do the same in the States, but we'd have to make common cause with psychiatry and other major mental health professions. Psychiatry will not work with us as long as we're pursuing prescription authority, but if we were willing to disavow that pursuit, and few of us have it, few of us want it, it would open up lots of potential referrals and would help to educate the general practice community, the general practitioners, and the public about how more efficacious psychotherapy is for most patients. Thank you very much. That's what I'd like to do.